They can't see Africa CDC.
Good afternoon and good evening, and thank you so much for joining us for this special briefing from Africa CDC. My name is Margaret, Edwin, the Director of Communications. I'll be moderating this session. The special briefing is touching on public health emergencies across the continent, and today we are honored to welcome back His Excellency Dr. Jean Kaseya, the Director General of Africa CDC. We are also honored to have with us Dr. Armando Sifna, who is the Director General of Public Health from Guinea-Bissau, who's standing in for the Public Health Minister. I will now hand over the floor to DG to start the session. Over to you, DG.
Good morning, good afternoon, good evening to all of you. Happy New Year, because it's my first time to be with you in 2026. Before starting, let me extend our condolences to the family of our colleague Amina Jumai Mohamed, who passed on 2 days ago, and all Africa CDC family. We think about the wonderful person she was and the support we provided to our member state to deal with the disease control and prevention issues. Today, I'm taking this press briefing with the Minister of Guinea-Bissau. I was talking with him. He is currently attending the cabinet meeting. I thank the President of Guinea-Bissau, the Minister of Foreign Affairs, and the Minister of Health who spoke to me. And once the cabinet meeting ends, he will join us. But to make sure that the country is there, he delegated the Director General, Dr. Armando, who is with us, and will convene the message from Guineans. Let us start with our presentation. It will be a high-level presentation, as you can see, with 3 main agenda items. Can we have the slides? The first one will be the overview of the epidemiological situation in Africa. Next slide, please. And the second one will be the progress on the implementation of the Africa Health Security and Sovereignty. And the third one will be the situation in Guinea-Bissau, because we need to discuss that on more transparent way. Next slide. We are led by the support that we are providing to our member states and the outcome and the impact coming from our countries. We wanted to start with this slide. You'll see after COVID, from 2022 to 2025, we saw a decrease in terms of public health events, outbreaks. You'll see in 2022, we had 279 public health events, and there was a decrease in 2023, an increase in 2024, but you see what we have in 2025 is more than 2021, but less than all of these years from 2022 to 2024.
Excuse me, DG, can I stop you for 1 minute? There is a background noise that has to be corrected. There's a background noise that needs to be corrected.
It's okay now?
Silas?
You can hear me?
We can hear you, but there's a background noise that is interrupting the session.
Okay. While Silas is trying to fix that, maybe we can continue. We are supported by the slides. Margaret will tell us if it's fixed. We are saying there are some factors that contributed to the success. The first one is we supported our countries to build a strong early warning system that is helping us to detect quickly.
Okay. Customer service. With our system, we have something called CRM. Our CRM is also customer system.
Maybe colleagues, you can mute yourself. Thank you.
Okay.
I said we managed to build a strong early warning system with a decentralized lab network and also digitalizing some of the surveillance systems in our countries. The second one, it's about the Public Health Emergency Operation Center that we managed to provide to several countries. That's why information we moved from 9 countries with Public Health Emergency Operation Center in 2022 to almost 40 countries today. And we also deployed the self-staffing, what we call the AVOC, the volunteers, and we built capacities of several public health experts. Today, our countries are benefiting from not only the staff, but also the SOPs that we managed to put in place. That is helping to shorten the time from alert to response. The third one is about the countermeasures. Medical countermeasures, it means vaccine, medicines, diagnostics, that we are making sure are available to support the prevention, the response, and we are also supporting what we call the case management by building capacity of health workers and community health workers. Because the community health worker component was reinforced and is helping for the response and the prevention. The last one, as you know, we took the agenda of the continent more seriously by building a strong continental coordination like the incident management support team for Mpox and other outbreaks. We also supported countries for their leadership and ownership by bridging countries with a strong cross-border coordination. All of that contributed to the success. Next slide. Our dream is to see in 2026 to do better than in 2025. In fact, you'll see that in 2026, the public health event reported for the same period of time represent 50% of what we reported in 2025. It means we are sustaining this progress. If there are still colleagues and journalists who are asking what is the impact of Africa CDC, this is one of the impacts of Africa CDC. Next slide. Talking about this impact, we are celebrating in about 4 days the end of the Margaret outbreak in Ethiopia. As you know, it was declared on the 14th of November 2025, and I was meeting the Minister of Ethiopia yesterday to congratulate her on the progress they made. Ethiopia, under the leadership of the Prime Minister and the strong support of the Minister of Health and the team, they managed not only to contain this outbreak, but to avoid this outbreak. And in Kenya, you can imagine having Margaret in South Sudan in this region could be a major challenge for us. On Monday, 26 January, I will join the Ethiopian team to celebrate the end of Margaret. Next slide. As you know, in August 2024, I declared Mpox public health emergency of continental security. I was supported by the recommendation made by the Emergency Consultative Group, ECG, where we have experts coming from Africa and the world to advise the Director General for the declaration or not of a public health emergency of continental security. As you know, our head of state, they gave this power to Africa CDC for Africa. A lot was done. It was a challenge for us to look for medical countermeasures, to look for funding, and to build capacities of our countries. As you can see, we were in the middle of a major fight in 2025. But today, we managed to control this outbreak. Next slide. Therefore, following the recommendation from the ECG, I want to inform you from today, 22nd January, I lift the status of public health emergency of continental security. And I thank the ECG colleagues who were meeting on quarterly basis to assess the situation. And the continent is so grateful. On your behalf, I send letters to be sent to each of them to recognize the support they provided to this continent. Lifting the status of public health emergency of continental security doesn't mean that Mpox is eliminated. No. It means we are considering Mpox as a disease we need to control, we need to continue to assess. And we are moving to the next phase with what we call the Mpox transition roadmap. And this control toward the elimination that we'll have will help this continent to start to deal with all other issues that will emerge. Next slide. We still have cholera, and we made some progress thanks to the leadership of President Chelema, our champion. As you know, in September 2025, he launched the Continental Cholera Control Plan that is helping us to deal with this cholera outbreak in Africa. We made some progress, but as you know, I was talking with Mozambique. Send even my condolences to the president of Mozambique for the flooding that killed more than 100 people in this country. And we saw this flooding in most of the Southern African countries. Flooding means next cholera outbreak. We are ready. From today, we start to activate our Emergency Operations Center and to see how to support our countries. This is also an opportunity for us to say all actions and decisions we made to control cholera in Africa must be implemented now. Next slide, you will see that this progress was translated in the decrease in several countries. Can we have the next slide? Except one country, that is DRC, where we see an increase if we compare the last week to the previous one. DRC is also affected by flooding, is also affected by a number of other factors, but we are still working to support this country as we supported, and we are still supporting other countries on the decrease of cholera outbreak. Next slide, we'll discuss quickly with you about what is critical in Africa today, what we call Africa Health Security and Sovereignty. This is our new vision in Africa. And this vision has 5 key pillars. The first pillar, when we talk about the reform of the global health architecture, is led by President Ruto. Why President Ruto? Because the AU gave him the mandate to deal with the reform of the AU system and dialogue with other partners. But because we is supported by President Ramaphosa and President Mahama. Each of them, as you know, is supporting some initiatives in terms of the global health architecture. For your information, we'll have a meeting in February led by our leaders to discuss the global health architecture. I will talk more about it when I will discuss on Friday with South Africa, because this initiative is not just an African initiative, it's bringing so many continents together. This PPPR agenda. The champion from African Union side is President Ramaphosa, but it's supported by President Bola Tinubu for the community health workers and by President Ichelema for the cholera. The third one is domestic resources, and the champion is President Kagame. The fourth one is the digital transformation. Just for your information, I'm submitting to the Committee of Head of State in a few days the nomination of Prime Minister Abiy Ahmed, thanks to all initiatives that he took in the digital area. And this morning, some of you will see my tweet, I visited the Ethiopian Artificial Intelligence Institute to see and to witness the progress that this country is making. And for the last pillar, we have the local manufacturing, and President Ruto was approved. Colleagues, let me be clear with you. Our vision is not coming from Western countries. Our vision is coming from Africa, shaped by African leadership, based on African realities. And this Africa Health Security and Sovereignty was approved by the Committee of Head of State and Government of Africa CDC in September 2025, and it will be presented by this committee to the AU Assembly in February 2026 for endorsement. Then it will become the only framework that will guide public health in Africa. And Africa Health Security and Sovereignty is replacing the new public health order that we were using before. But in this new public health order, we didn't have the digital agenda, and we didn't have a strong component on the global health architecture. For some of you who are still using the new public health order, now please start to use Africa Health Security and Sovereignty. Next slide. I heard from some colleagues they wanted to know what is exactly the interaction of Africa CDC with the US and other partners. Let me tell you, we are not an NGO. We are not a UN organization. We are the convening power in Africa. The mandate given to us by all 55 African heads of state and government, based on the Statute of Africa CDC that they approved. What did we do to support our countries? Because our first role is to support our countries. When we had Margaret in Rwanda, and when the US declared the L3 status, that was considered as the travel ban. Only one organization, only one, Africa CDC, sent a letter that I signed to Xavier Becerra, to the US CDC director, to the chief of staff of the president of the US, to challenge the status. And later, we advocated and we supported, we worked together with our US people, colleagues, and with the Rwandan colleagues, we got the lifting of the status. We are proud of that. If people they don't want to talk about it, we'll talk about it. Because we supported Rwanda from the first day to the last day, in all aspects. We have the courage to say things. The insecurity in DRC, Africa CDC was the only organization to send a letter to all African heads of state, providing information on what was going on and why this insecurity will be a major problem, not only for 2 or 3 countries, but for the continent, because of 70% of some outbreaks we had at that moment were coming from this region. Let me tell you, this one was discussed during a joint SADC EAC meeting of heads of state as a referral document to support the peace agreement. More than that, when Rwanda and DRC started to negotiate peace under the framework of what we call the Regional Economic Integration Framework, health was not a component of this framework. Africa CDC stood up to negotiate with authorities of DRC, Rwanda, and US to have a substantive health program there. More than that, it's Africa CDC that developed the document that is in this framework on the health component. We are proud of that because we believe investment that will be made in the health sector will contribute for the peace and development of this region. For those who don't know, when we talk about America First Global Health Strategy, we in Africa CDC, we advocated for that in March, and you can see what I'm posting to you in my slide, what came from the State Department after this meeting. We had this meeting, a 4-hour meeting in State Department with all the US agencies working directly or indirectly in the health area. My message was clear to them. We need another approach of financing health in Africa. We need you to give money directly to countries to help them to start to manage. But they have also to contribute to co-finance all programs. In March 2025, I was talking about sovereignty of Africa. And today, we have, depending on sources, around $18 billion in the pipeline for African countries. Yes, there are some issues we can still discuss about issues, but this is the approach that we promoted, and we are proud of that. Africa CDC supported a number of outbreaks, as you can see, as I presented. But when we declared Mpox as public health emergency for continental security. We had the opportunity to sit with the US. I had a meeting with Secretary Xavier Becerra, with Secretary Anthony Blinken at that moment to unlock 1 million doses and $500 million. We are proud to play that role for our continent. We are proud to say we have a strong partnership with the US government, a respectful partnership, a partnership that is led by our vision in Africa. Every time when I'm meeting our US, our European and other partners, we are clearly saying we are led by the vision from our head of state. Next slide, you will see that last week I was in Brussels and in Geneva, co-creating in Brussels with the European Union Commission the new program that President Ursula launched called Global Health Resilience Initiative. We agreed to co-create this program and will have regular meetings till when this document will be out. I was with my colleagues in Geneva meeting Gavi to co-create what we need to do together to deliver successfully the Gavi 6.0. And I was meeting my brother, Dr. Tedros, to discuss the reform of the global health architecture. Because Africa and Africa CDC, we are a major actor on that. People can meet in the US, they can meet in any country in Europe. If we are not there, they are wasting their time. We are part of that, and we are leading this agenda. Next slide. Now, let us talk about Guinea-Bissau. I don't know if all of us we know this country. And let me inform you that when I was elected by African Head of State as Director General of Africa CDC, the first country I visited in 2024 was Guinea-Bissau. Mainly because there was also a meeting of ECOWAS in Guinea-Bissau. These are some information from Guinea-Bissau. See the percentage of national budget for health. It's still low. See percentage of people getting access to basic services like water, like sanitation, less than 25%. But if we go to the next slide please. When we talk about health indicators, you'll see Guinea-Bissau, if we compare not with all African countries, but the sub-Saharan African countries, the indicators are still a major issue. But I thank authorities of Guinea-Bissau. They know that. They are doing their best to address that. Specifically, let us talk about hepatitis B prevalence. You see, 1 out of 5 children born in Guinea-Bissau, they are at risk to develop cancer or a chronic disease linked to hepatitis B. This is a major public health issue. And we started to discuss, to hear about hepatitis B vaccination in Guinea-Bissau. Let me be clear and transparent. Next slide. In Africa CDC, we are led, and I provide the link. Some of you can go and you will see that document. The Africa CDC guidance for any clinical trials to be conducted in Africa. A clinical trial conducted in a specific country is under the leadership of the country. They are In total, around 13 steps in our document to guide our member state to know how to move forward. But here I'm giving you the 4 critical steps. As I said, you can just go in our website, you'll find this document. The first one is the National Regulatory Authority. National Medicine Regulatory Authority must approve that. And I give you the 7 documents that are required. If we don't have the National Medical Regulatory Authority approval, this trial is illegal. The second one, after securing that, we have what they call the ethics approval. This National Ethics Committee in Guinea-Bissau, now we are talking about Guinea-Bissau, must sit, analyze the document, and they will review a number of issues regarding voluntary participation, culturally appropriateness, risk minimization, protection of vulnerable populations, and so and so. Then they will issue the approval. Next slide. After securing these 2 approvals, we have now the government providing the political clearance. Depending on countries, it will be either the Minister of Health providing, or it will be interministerial committee, or it will be the cabinet providing. Because, and as the Minister of Foreign Affairs was telling me, as the Minister of Health was telling me, this issue is involving people, populations. They have to know. They have to know that they are protected by the authorities. And authorities they are electing are ministers who must sit and say, we clear that. And the 4th one is what we call the regional or continental coordination. Many countries, and this is the case of a Guinea-Bissau, requesting support from Africa CDC. They want to make sure that they are compliant with the Africa CDC guidance, with their regional economic community framework, and with also WHO norms. That one is mandatory when, especially for Africa CDC, when it's a multi-country trials. But it becomes also important when we are talking about complex national clinical trials. Please keep that in mind. For you to understand our message today, Africa CDC is respecting and supporting the sovereignty of the country. It's not Africa CDC that will say this clinical trial will take place or not. It's not any other international body that will come to say this clinical trial will take place or not. It's not a foreign country that will come and to say this one will take place. It's the sovereignty of the country. I was talking with the minister who called me 3 days ago. And he clearly told me, DJ, I'm a new minister. I'm still waiting for the 2 steps, the National Medicine Regulatory Authority and the National Ethics Committee, to come to brief me and to give me their recommendations. I'm also asking if Africa CDC can come and support us to see this protocol and all other documents. Then I can make a decision based on this recommendation. He told me, and we have Guinea-Bissau attending this call, this meeting, that for now the study is postponed till when it will get all documents. Then we will make decision. We are led by the sovereignty of the country. As DG Africa CDC, I fully support I will stop my presentation there, and I will give you opportunity, colleagues, journalists, to ask your questions, and then we can interact. If questions are related to Guinea-Bissau, we have also colleagues from Guinea-Bissau attending this call. Thank you, Margaret. Back to you.
Thank you, DG. Let's cross over to the floor. We have Melody from The Guardian UK. Melody, you have the floor.
Thank you so much. I'm from The Guardian US. Thank you so much for taking these questions. I'm very curious about the trial in Guinea-Bissau. I was wondering if the HHS statements against Africa CDC, calling it a powerless and fake organization, will affect the future of collaboration with global entities like Africa CDC. And then with the Guinea-Bissau trial specifically, how much would it cost to vaccinate all newborns against hepatitis B? And is there a possibility of rolling out that campaign earlier? Gavi was planning to begin that in 2027. I think the Minister of Health mentioned 2028, so I wanted to clarify that as well. Thank you so much.
Back to you, DG.
Thank you so much. You know, when you are leading a continental organization, you are not led by rumors. We have our diplomatic relationship with the US. Yesterday, senior people from HHS were talking with senior people from Africa CDC. And I was briefed that they don't know anything about any statement against Africa CDC. And Africa CDC is a respected and a continental convening power. I have so many meetings with the US, and you saw, I shared with you. Then if there is something, we know how we talk with our colleagues. But I can tell you about a statement that could be somewhere made by someone, but officials from HHS yesterday, senior people, said they don't know anything about the statement. I trust them. I've closed the chapter, and I will not continue to talk about that one. Regarding what can happen and when in Guinea-Bissau, as I told you, the government officially had a meeting with me, and they told me they will be led by science. They are waiting for the ethics committee. They are waiting for the National Medicine Regulatory Authority to meet. They requested support from Africa CDC. I'm sending tomorrow my team to Guinea-Bissau. They will have opportunity to meet. And we will even request also the government to invite other colleagues from the US, from Denmark, from any country that can provide also some information. Because we want the minister to make an informative, a decision based on science, based on recommendations that will come from the group. Of course, I'm not the minister of Guinea-Bissau. I'm not member of the cabinet. I don't know what will be the decision from Guinea-Bissau. But let me tell you, I will support the decision that will come from Guinea-Bissau. Next question.
Great. We have Paul from The Lancet. Paul, you have the floor.
Yes, thank you very much. Taking the question further, has there been any direct interaction between the Africa CDC and the institution that is expected to carry out this study? I think according to the official documents available publicly is the University of Southern Denmark. Has the Africa CDC had any direct interaction with them? Then, still speaking on the US Africa CDC interaction, you've highlighted the kind of relationship you've had over the years, but the Trump administration this week celebrated its first year. Can you give us an insight regarding the direct financial support that the Africa CDC has directly gotten from the US government in the past 1 year? When I was reading the America First Global Health Strategy, the involvement of the Africa CDC was largely restricted to supporting the US government in enhancing America First security. And how does that align with the key focus of the Africa CDC, especially when we are seeing African governments cutting direct bilateral deals with the US government directly, not involving the Africa CDC itself? Thank you.
Thank you. Back to you, DG.
Yes, Africa CDC is a member state organization. And we need to receive requests from our member state. And I'm clear on that. When we receive a request, we act. There is no member state who requested support from Africa CDC and didn't get it. And when we get a request from a member state, they will also provide a number of documentation, and they will provide also some of actors we need to deal with. For now, we got the request from Guinea-Bissau. As I was saying, the team will fly to Guinea-Bissau, and authorities, they will share with us. For now, as DG, I don't know everything about or around the study. No. I'm led by what we are discussing, and I will wait to hear more from the team that will be in Guinea-Bissau. And then we can see what we can do, or if we can have other actors, including the institute you are talking about. Because currently, we are not talking to them, we don't know them, and we don't know how to deal with them. Regarding our relationship with the US government, we have excellent relationship with the US government. All components of the US government, executive and the legislative branch. And let me remind you also, I hired as a special advisor someone who was leading the Africa Bureau in the US, Troy Fiedler. Is my advisor today. It was public, it's not a scoop. We are led by the interest of our people in Africa. We are not led by the small interest of individuals, no. We negotiated billions of dollars for our member state. Those who attended the launch of America First Global Health Strategy in September, there was only one organization that was named to support this program. Only one. Africa CDC. But we are there to support our member states and to work in collaboration with our partners. We made a clear decision not to be part of the visit to countries because we wanted to continue to play our role. It's not because they didn't want us to be there, no. It's because we decided not to be there. But what we did, we organized before the visit, and after the visit, we organized a meeting with all countries. All of them attended. And we are supporting our member states. For your information, on the 13th of February, I'm organizing a meeting with all means of health, some means of finance. And we'll discuss also on the way to support them to implement. Signing is one step. A critical one is compliant, making sure that our countries will successfully implement the program. The US is not the only program that we have in Africa. Our countries have also partnership with so many other partners, Europe, World Bank, Japan, and so and so. This is why I'm releasing in the next 10 days a 200-page document called Financial Implication of Africa, Health Security and Sovereignty. You will see in this document that by fixing the inefficiencies that we have in Africa, ghost workers, fraud, lack of planning, integrated planning process, having a pool procurement mechanism, by doing that, Africa will move quickly out of dependency. I commit you will receive this document and we'll discuss that. Some of you will attend the AU Assembly, please come to attend this meeting 13th of February. And you'll see how we are discussing with our ministers to make things moving. Back to you, Margaret.
Thank you, DG. Let's cross over back. We have Kerry from Health Policy Watch. Kerry, you have the floor.
Thank you, Margaret. I would really appreciate it if somebody from the Director General from Guinea-Bissau would maybe clarify for us the trial, because I'm still, forgive me, I'm still puzzled, because on the 14th of January, there was a new protocol, trial protocol that was issued, which clearly stated that the Ethical Committee of Guinea-Bissau has approved the trial. So I would just really appreciate it if the DG from Guinea-Bissau could explain what ethical steps have been taken around the trial and what issues they are still waiting for clarification before the trial resumes or is cancelled. Thank you so much.
Thank you, Kerry.
Dr. Armando, over to you. You can respond in Portuguese.
Good afternoon, everyone.
Yes, we can hear you.
Good afternoon. This is already in the meeting, and then now I'm going to let him to speak now.
Minister, my friend and my brother, happy to have you. And I really appreciate your leadership. I told our colleagues and journalists that you are attending the cabinet meeting, but you do your best to join us. Thank you so much. Over to you, Minister.
Ok, muito obrigado a todos. Digníssimo Diretor-Geral da Africa CDC, caro membro da Africa CDC, caros parceiros técnicos e financeiros, minhas senhoras, meus senhores e senhores das empresas. Permita-me, antes de mais, partilhar convosco uma visão clara, responsável e comprometida sobre a situação da saúde na Guiné-Bissau. Num contexto em que a solidariedade, o reforço da cooperação regional e a coordenação a nível continental se impõem como pilares fundamentais para a sustentabilidade e a resiliência dos nossos sistemas de saúde. A Guiné-Bissau continua a enfrentar uma elevada carga de doenças infecciosas evitáveis, associada a desafios persistentes nos domínios da saúde materna, neonatal e infantil. Não obstante, os progressos significativos alcançados nos últimos anos, particularmente no fortalecimento da imunização,
in the area of immunization, epidemiological vigilance, and increasing our response capacity to outbreaks.
Por limitações estruturais profundas que ainda marcam o nosso Sistema Nacional de Saúde. Os indicadores de saúde materna, neonatal e infantil continuam a suscitar séria preocupação. A mortalidade materna mantém-se elevada, estimada em cerca de 548 mortos por 100.000 habitantes nascidos vivos, refletindo o acesso ainda limitado a partos assistidos por profissionais de saúde qualificados e a cuidados obstétricos de emergência. Do mesmo modo, a mortalidade neonatal e de crianças menores de 5 anos permanece fortemente associada à complicação do parto, infecções neonatais, malária, doenças diarreicas e pneumonias. A pobreza estrutural, a insegurança alimentar e o acesso limitado à água potável e ao saneamento continuam a influenciar de forma decisiva os indicadores de saúde da população. Outros desafios são limitações nos recursos humanos para a saúde, marcada pela escassez, distribuição desigual e dificuldade na retenção dos profissionais, comprometendo a prestação equitativa e contínua de cuidados de qualidade. Forte dependência de financiamento externo. Rupturas periódicas nas cadeias de abastecimento de medicamentos e vacinas. Sistema de informação ainda insuficientes para uma tomada de decisão em tempo real. No perfil epidemiológico, a malária mantém-se como a principal causa de morbilidade e uma das principais causas de mortalidade infantil, representando cerca de 30% a 40% das consultas ambulatórias, com transmissão perene e maior intensidade na estação chuvosa. A tuberculose continua endêmica, com subdiagnóstico e início tardio de tratamento, sendo agravada pela coinfecção de TB-VIH. A prevalência de VIH em adultos, estimada em 3 a 4%, permanece elevada para a África Ocidental, com desafios persistentes no diagnóstico precoce, retenção e adesão ao tratamento. Merece destacar, em particular, a hepatite B, um fardo silencioso de grande magnitude, com uma prevalência estimada em 18%, superior à do VIH. Permanece ampliamente subdiagnosticada, apesar do seu impacto significativo na saúde pública. Relativamente à proposta de realização do estudo intitulado Os efeitos na saúde geral associada à vacinação neonatal contra a hepatite B, um ensaio clínico randomizado na Guiné-Bissau pelo Projeto de Saúde de Bandim, foi realizada uma análise técnica aprofundada. Dessa análise, constatou-se o seguinte: a existência de falha significativa de coordenação institucional, nomeadamente a ausência de articulação prévia com o Instituto Nacional de Saúde Pública, INASA, entidade legalmente responsável pela orientação, coordenação e supervisão das pesquisas em saúde no país, bem como com o Programa Alargado de Vacinação, PAF. A não apresentação das atas da reunião de aprovação do protocolo de estudo pelo Comitê Nacional de Ética em Pesquisa em Saúde e INEPS, uma consequente disseminação de desinformação nos meios de comunicação social, redes sociais e alguns órgãos de comunicação internacionais, gerando interpretações incorretas sobre as políticas nacionais de vacinação e de investigação em saúde. Face a esta situação e uma observância rigorosa do quadro legal e regulamentar nacional, o Ministério da Saúde decidiu cancelar a realização do referido estudo. Importa sublinhar que, de acordo com o calendário vacinal nacional, a introdução da vacina contra a hepatite B está prevista para o ano de 2028. Agradecemos imensamente a colaboração e o apoio da Africa CDC, OMS, Gavi, Unicef e demais parceiros que apoiam a Guiné-Bissau. Para terminar, quero deixar a mensagem clara sobre as nossas prioridades estratégicas, que incluem reduzir a morbilidade e mortalidade por malária, especialmente entre crianças e mulheres grávidas. Reforçar a preparação e a resposta às doenças de transmissão hídrica através de intervenções estruturais em água, saneamento e higiene. Melhorar a gestão integrada da VIH, da tuberculose e da hepatite B, com foco no diagnóstico precoce e na continuidade dos cuidados. Reduzir a mortalidade materna e neonatal através do fortalecimento dos cuidados de saúde primária e do sistema de referência. Investir de forma sustentada em recursos humanos, vigilância epidemiológica, laboratórios e cadeias de abastecimento. Manter o envolvimento comunitário, a transparência e a confiança como pilar central da saúde pública. Muito obrigado. Thank you, my brother.
Thank you so much, Minister. I will not comment. We let journalists to ask questions if there are questions.
Let's cross over back. We have here, we have Stephanie Nolan from the New York Times. Stephanie, you have the floor. Stephanie, if you can hear us.
Sorry, did that work?
Yes, we can hear you. Go ahead.
Thanks, Margaret. Just to stay on the topic of this trial for a second, if I could put a further question to the Honourable Minister from Guinea-Bissau. Eu posso fazer em português, se o senhor quiser. Eu ficaria muito grato se o senhor pudesse esclarecer um ponto. O New York Times entrevistou um funcionário do Comitê de Revisão Ética que nos disse que o estudo foi aprovado em novembro. Também entrevistamos os pesquisadores da Universidade do Sul da Dinamarca, que afirmaram ter todas as aprovações éticas necessárias. O senhor está dizendo que eles não tomaram todas as medidas adequadas? Ou está dizendo que quando você tomou conhecimento das preocupações sobre esse estudo, concluir que os protocolos existentes precisavam ser revisados? Estou tentando entender melhor como chegamos a esse ponto. Muito obrigado.
Ok, muito obrigado pela preocupação e pela pergunta feita. Nós, na Guiné-Bissau, como pode saber, temos uma ética, uma comitê de ética que é responsável e mais estruturas de saúde responsáveis para a decisão final do ministro da tutela. Segundo o texto que eu acabei de ler, dá-se a entender que não houve uma coordenação entre estruturas competentes para a decisão final deste estudo. Inclusive, ontem reuni com o Comitê de Ética, que é para saber quando e como foi decidido o assunto, e não tiveram ata de reunião, de aprovação da reunião em curso. Até este momento não recebemos nenhuma ata referente à aprovação do estudo no país. Portanto, enquanto ministro, tenho que apoiar nos técnicos, não posso adiantar politicamente levar assunto dessa envergadura ao público, sem ter um factos técnico aprofundado para poder decidir. No entanto, decidimos por cancelar exatamente este estudo, atendendo não só a técnica, mas também da vinculação de informação por rede social, desinformando profundamente a comunidade guineense, inclusive
Yes, maybe there is a network issue, but if I don't know how the translation is going, but what the minister is saying is suspended the clinical trial, is using two words, suspend or cancel, but he said is suspend or cancel pending recommendations that he will get after the review of technical people. And he's saying he requested support and he will provide any guidance and any support needed for technical people to work, and then he will make decision. I think this is in line of what we are telling you. It's the sovereignty of the country to make decision on the study. And we will support the country at technical level for the minister now to make decision. I don't know if the minister is back. Maybe you want to provide more information. Minister, are you back? I was just summarizing what you said. Okay. Margaret, back to you for another question.
Thank you very much. Thank you, Honorable Minister. We have Abdullah Sani is an editor with Nature. Abdullah, you have the floor.
Thank you very much, Margaret. I was a little bit disappointed by the speech by the minister because I think it did not really address some of the concerns that researchers have raised around this trial. I would like to know, is the Guinea-Bissau Ministry of Health and Public Health authorities, are they involved in the design of this study?
Yeah, maybe before the minister, let me say, Abdullah, the minister didn't start the meeting with us. He had what we call the introductory remarks. The minister wants to provide the situation of Guinea-Bissau because I also briefed you in 2 slides, but it's the minister. He wanted to tell you that the country is still facing a major morbidity and mortality issue in terms of maternal mortality, child mortality, in terms of access to basic services. Just consider that that one was the introduction from the minister.
Okay.
Then the minister had to deal now with the issue, the study. And he clearly said that the study will be pending on the review from technical people, and he will get recommendations from technical people, and they will make this decision. But the minister is there. Minister, I was just summarizing because maybe colleagues, they didn't get you very well, and I wanted to support what you were saying regarding Guinea-Bissau. Over to you, Minister.
Yes, we would like to know, can he just give us a sense of finality to this trial? Will it proceed or not? And are the public health authorities in Guinea-Bissau involved? And how much involvement do they have over this trial? Basically, what I'm trying to say is there have been a lot of confusion. Africa CDC, even today, the latest report in Reuters says that this study is under review by Africa CDC. But I also got, I reached out to the HHS today, and they said that this study is going to proceed as planned. So who gets to control this research and this work that is about to go on in Guinea-Bissau?
Over to you, Honorable Minister.
Obrigado pela pergunta. É só para dizer que nós fizemos, ou estamos dentro da comunidade da África, na sub-região. Não podemos, de modo nenhum, afastar de qualquer organização ligada à saúde, porque estamos fracos e contamos sempre com o apoio do CDC África. O importante é dizer que não temos evidências técnicas por parte do Comitê de Ética para podermos decidir sobre a matéria. Sendo assim, não podemos, porque temos que respeitar as nossas estruturas internas, especializado nas matérias. Portanto, eu disse há bocado que não houve uma
Honorable
Yes.
Minister, can you hear us?
Just when the minister is back, please let us know. But Abdullahi,
DG, can you address this? You said that you will wait to hear from Guinea-Bissau. Are you saying that you are willing to go along with this trial?
What I'm saying, and I will repeat it, I'm consistent. Africa CDC doesn't make decisions. And what you say, the study is under review by Africa CDC, is not accurate. We are not reviewing the study. The study is under review by Guinea-Bissau under the leadership of the minister. Africa CDC will just provide technical support to Guinea-Bissau as the country requested. This is the way we see that. And I clearly said, I will support the decision the minister will make. I don't know what will be this decision, but I will support the decision that the minister will make. I think, Abdullahi, we are clear on that. I see the minister is back. Over to you, Minister.
Back to you, Honorable Minister, if you can hear us.
Nós temos nenhuma objeção quanto ao envio de uma equipa técnica que é para poder trabalhar com a entidade nacional ligada ao estudo. Não temos problema. Nós sempre contamos com o CDC África, em qualquer momento que acha que há uma necessidade de fazer um estudo ou implementação de qualquer tecnologia a nível do país. Portanto, estamos com braços abertos. Obrigado.
Thank you, Honorable Minister. Let's take the next question. We have Catherine is an investigative journalist from the US. Catherine, you have the floor. Catherine, if you can hear us.
Hello, can you hear me now?
Yes, we can hear you. Go ahead.
Okay, thank you so much, and thank you for taking my question. I'm wondering if Dr. Sifna could clarify exactly the ethical committee within Guinea-Bissau that approved the study, how many members there were, and whether they have released a list of the members for that committee and what that process was like receiving approval.
Thank you, Catherine. Back to you, Honorable Minister.
Ok, obrigado mais uma vez. O Comitê de Ética da Guiné-Bissau é composto por 6 elementos, 6 membros. Tanto 6 membros e, pelo visto, não temos nenhuma evidência quanto à reunião que eles fizeram, nem sequer temos uma ata de aprovação de conselho. Nós pensamos que eles não têm reunido, não reuniram e não trataram o assunto adequadamente. Obrigado.
All right, let's take the next question. Let's take the next question. We have here Paul from the Lancet. You have your hand up. Do you have another question?
Yes, please. Thank you very much. Honorable Minister, do we have insights into the bilateral agreement, because the U.S. government is agreeing with a lot of African countries regarding its funding for their health program. What is the current status of the bilateral agreement between Guinea-Bissau and the U.S. government? Thank you.
Back to you, Honorable Minister.
No que refere ao assunto bilateral, ao acordo bilateral, é assunto referente ao Ministério dos Negócios Estrangeiros. Portanto, não tenho aprofundado alguma informação relativa, mas, particularmente, enquanto cidadão, acho que acordos bilaterais são sempre bem-vindos para ambos os países. Portanto, não podemos ter algo contra acordo bilateral entre Guiné-Bissau e Estados Unidos. Mas é a coisa que se trata no Ministério dos Negócios Estrangeiros. Obrigado.
Sir, I was referring to the America First Global Health Strategy, which is laser focused on the health aspect that U.S. government is signing with respective African countries to determine how they are going to fund and support their health programs.
Honorable Minister, back to you.
Sim, isso pode ser verdade, o acordo está assinado, mas estamos a referir o caso do estudo referente à hepatite B nas crianças recém-nascidas. Eu disse há bocado que nos falta alguns ingredientes, alguns elementos fundamentais, que é a evidência da ética, da Comitê da Ética, referente ao estudo. Portanto, foi isso meramente a dificuldade que temos para poder decidir quanto ao estudo. No que refere acordos, são acordos políticos, pode ser também um acordo ligado à saúde, é importante, mas estamos a referir exatamente no que diz respeito ao estudo sobre a aplicação da hepatite B nas crianças, nos recém-nascidos. Na vacinação.
All right, let's take the next question. We have here Rachel Abuja is from the Nigerian News Agency. Rachel, you have the floor.
Thank you very much, Prof. Minister, and thank you, Margaret. Given the low coverage of health services in countries like Guinea-Bissau, what step can be taken to accelerate hepatitis B dose vaccination rollout? And what are the estimate costs? Because somebody mentioned it and the minister did not answer, or the minister was not on board then, to ensure that all newborn are vaccinated as early as possible, given the fact that what stopped the trial from taking place is misinformation. And I was expecting the minister to tell us what they are doing around that to ensure that people understand what is happening instead of being misunderstood. For the DG, African CDC emphasized that member states retain full sovereignty over clinical trials, yet global partners are often involved. Yeah. So how does African CDC ensure that African priorities and decisions are respected in this partnership, and that external pressure do not undermine, or how will I put, undermine national and continental authorities? Thank you, and over.
Thank you, Rachel. Let's cross over to the minister and then we'll come to DG. Honorable Minister, over to you.
Ok, obrigado mais uma vez. É só para dizer que o assunto foi para além, foi demais nas redes sociais. de tal forma que a população está profundamente desinformada e não estão preparados para imediatamente começar a fazer o estudo. Essa desinformação das redes sociais levou com que a população está desinformada. No entanto, é razão fundamental também, politicamente, dizer que falta uma fase de sensibilização perante a população e daí poder, de facto, atendendo a técnica do comitê de ética, fazer uma decisão cabal e podermos entrar nessa senda do estudo. Obrigado.
Yes, thank you. I think, Rachel, you are getting a response to your question when the minister is responding. Our role as Africa CDC is to remind our global partners that we need to follow the sovereignty of our countries. And us as Africa CDC, we are supporting countries to make decisions based on the recommendations that are led by a number of factors, including science and others. We are talking to our global partners. Today, Africa CDC is sitting for the minister of Guinea-Bissau. It's a testimony that we are supporting our member states. Today, so many partners are connected. They will follow the decision that the minister will make. And I think there is no other way to support our countries, all of our countries, if not to remind our partners to respect the sovereign decision coming from countries. And this is what we are doing.
Thank you, DG. Let's cross back to the floor. We have Sarah Javing from the DVEC. Sarah, you have the floor.
Thank you so much for this briefing. I have a question for Dr. Kaseya. What are you hearing about the bilateral health agreement signed between the U.S. State Department with African governments that haven't already been announced? And do you currently have any concerns around them? And which countries are in the line for signing next? Thank you.
Thank you, Sarah. As I said, Africa CDC, we supported the process from the beginning when no one knew that this program can even be developed, March 2025. We continue to have regular conversation with our US colleagues. We were invited when this program was launched. It was clearly said during this launch that Africa CDC will be part to support the implementation. The way we consider that is to strengthen the capacity of our member state to talk with the US counterpart by respecting the sovereignty of our countries. You know, when we talk about respect of sovereignty, it's not just about global partners they must respect. As the continental organization, we need to respect the sovereignty of our countries. We had a meeting with member states. Each of them shared with us and with other ministers what they negotiated, how they negotiated, amount of money they secured, what they think was the process, and we got positive feedback from member states. In general, we got very positive feedback. They said the process was so respectful. They felt understood by the US partners. They also raised some concerns, and these concerns, some of them managed to fix, Others, they're still negotiating. I know there are countries still negotiating. Zambia, DRC, Namibia, these are like a few countries, they are still negotiating to fix a few things. But we are clear, they need our support, we provide support. But it's them to make decisions. They are making decisions and we respect their decision. We saw some countries, they got more than what was offered to them after negotiation. We saw others, they accepted what was offered to them. We saw some countries negotiating about data sharing, about pathogen. We let country finalizing that. Now, as I was saying, my brother, the Minister of Equatorial Guinea, will be in Addis in February. He will meet with other ministers. We'll have an opportunity to talk physically with other ministers, how things are moving. If there is any additional support, we'll provide the support. I think, Sarah, we are mostly from member state side, not from the US side, if you want to understand how Africa CDC is moving in this context.
Thank you, DG. Let's take the next question. Stephanie, you still have your hand up. Do you have an additional question? Maybe not. Melody, I can see your hand. You have the floor.
Wonderful. Thank you so much. I'm sorry to pull us back again to hepatitis B. Honorable Minister from Guinea-Bissau, I wanted to put the same question to you. Will the trial be delayed until 2028 now? Gavi had planned to roll it out in 2027 with coordination with Guinea-Bissau, but is that being delayed due to logistical issues? And my second question is about this trial. Is it a concern that the ethical review board of the sponsoring country did not conduct an ethical committee review, which is the standard under the Helsinki Declaration? Thank you.
Thank you. Back to you, Honorable Minister.
So we missed the connection. Can you repeat the question, please?
Sure, you can still hear me?
Yes.
So the question is two parts. Is the hepatitis B vaccine rolling out to all newborns in 2028 or 2027? And what's the reason for that? And the other question is, with this trial on hepatitis B from Danish researchers, is it a concern that they didn't seek, apparently, approval from their own ethical board at the University of Southern Denmark, or from the US, which would be the standard under the Helsinki Declaration on conducting global research? Thank you.
Over to you, Honorable Minister.
Obrigado. É verdade, confirmo que a vacina vai se iniciar em 2028, a nível nacional, e nós asseguramos isto porque se fazem em muitos países da África e da Europa, a vacina se implementa nesses países, portanto, de acordo com a política nacional, apoiado por OMS também, tanto acho que tínhamos que tomar essa decisão de iniciar a vacina em 2028, tendo preparação prévia de todos os dossiês e todos os argumentos técnicos para poder implementar essa vacina. De facto, não tínhamos, não temos respeito, como posso dizer, não consideraríamos este estudo, porque era uma coisa muito antes de pensar no estudo sobre hepatite nas crianças. Portanto, de facto, foi uma decisão nacional, apoiada também por alguns parceiros. Obrigado.
Thank you very much. Let's cross back to the floor. We have Ida, is a journalist in South Africa. Ida, you have the floor.
Thank you very much, Margaret. Thank you, everybody, for the opportunity. Dr. Sifna, I would like to know from him, what does he regard to be the current position of the US CDC, the US Health and Human Services, and the Danish Research Group? In his mind, are they acknowledging that the trial is postponed or cancelled, as he says? In other words, does he have anything in writing from any of those three entities? And the second question is regarding the Danish Research Group, which we know has been involved in a controversy in Guinea-Bissau before. I wanted to know a little more about the special, or if so, about the relationship of this Danish Research Group with Guinea-Bissau, how long it's been going on, what the relationship is between that group and the country. Thank you. But more specifically, what confirmation has there been from these three entities about acknowledging the cancellation? Because, of course, I asked that against the background of there having been confirmation, cancellation, confirmation, as we know. And we want to know if there's anything different this time. Thanks.
Thank you. Back to you, Honorable Minister.
Muito obrigada, senhora. Para dizer à jornalista que acabou de fazer a pergunta, de que na realidade cancelamos o estudo por falta de parecer técnico do Comitê de Ética Nacional. Nada mais que isso. Portanto, não estamos contra, a nossa cooperação vai manter e pedimos sempre o suporte do CDC África. Obrigado.
All right, let's take the last question here. We have Paluku, who is a journalist in Rwanda. Paluku, you have the floor. Paluku, can you hear us? Okay, never mind. Yeah, so that would be the last question. That will be the last question from our end. I will now hand over the floor back to DG for your closing remarks and to the Honorable Minister. Maybe you can start with the Honorable Minister and then we will cross over to DG. Honorable Minister, if you have any last words, back to you.
Muito obrigado. Para finalizar, eu tenho que agradecer ao meu amigo, o diretor de CDC África, dizer que nós sempre contamos com o CDC África em todo momento e o problema que se põe aqui tem a ver simplesmente com falta de evidências técnicas por parte do Comitê de Ética da Guiné-Bissau. Muito obrigado. Cumprimento a todos.
Let me thank the minister. As I said, he had a cabinet meeting. He managed to exit himself from the cabinet meeting to come to address the world and to share what Guinea-Bissau thinks about the health system, about challenges they are facing, and the minister spoke a lot about lack of resources, about strengthening partnership, about requesting support from all partners to respond to the need of the people from Guinea-Bissau. And the minister also clearly said he will make decision when we'll have all evidence regarding the study that we are discussing about. I think for now, we really need to thank the minister for taking this time being with all of us together. I want also to thank our colleagues journalists for taking the time to be with us for my first press conference this year. I commit to be with you every month because there are a number of issues ongoing. And I also want to share with you those who will be around in Addis for the AU Assembly. Please inform our director, Margaret. We'll see how to organize some meetings and to give you more information. We want to say African priorities will be led by African leaders, and it will be supported by our partners. Today, we are celebrating the strong relationship that we have with the US, Europe, Japan, Canada, and so many others. And partnership means also respecting our vision. That is the Africa health security and sovereignty in Africa. We'll have opportunity to discuss more about it when you'll be in Addis. And I want to thank all of you for being patient. Today we took 1 hour 30, but we'll have ongoing conversation. Please don't hesitate if you have questions to send to Margaret, our director. We'll channel either to the minister or she will channel to my office and we will respond to your questions. Thank you so much.